about 10 seconds. Hi, I'm Lacey Nobles. Our news conference will start in just a few seconds. Hi, good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. Today's panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, and Lubbock Mayor Dan Pope. But right now, we're going to share a video with you to give you a behind-the-scenes look of the COVID vaccine clinics that the City of Lubbock has been putting on for just over a month. End of December, tens of thousands of people have gone through the City of Lubbock COVID-19 vaccination clinics at the Memorial Civic Center.
Is this your first or second? Second dose. You're going to go straight down this row on the right.
We have the largest space in Lubbock, and we're able to put it to good use and help get the vaccines out to our community.
I can tell you unequivocally that what we are doing here makes a difference.
So I actually think it's been critical for our community to come together in this way.
Since the first week, it seems the large-scale vaccination clinics have run like clockwork.
I've actually served as a scribe. I've served to help us draw up vaccines, and I've helped administer those vaccines to the people here in this community.
On a normal clinic day, I staff up to 20 to 25 licensed staff, and then I have up to 60 volunteers for each day. And we've never been short on any of those days.
I've seen incredible volunteers from Lubbock in our area to get these important vaccines out on a daily basis.
But like any event of this magnitude, there were minor bumps that called for adjustments along the way, like using Select-a-Seat as a more efficient way to make vaccination appointments.
We noticed that the phone line, it's a really slow way to get appointments made because you're interacting with each and every individual. And when you can offer something online, then you can move through that process much faster. So we are using a ticketing software that is meant for an event. So there have been a few little hiccups with that. For example, we have to put in that there's an event time. Today's event, which is the clinic, started at 10 a.m. So a lot of people think that that's their appointment time. Their appointment time is actually within their seat location. So we really want people to look through their appointment that they receive online. The Select-a-Seat staff's doing great. They're sending out secondary emails to get that information out so that everybody knows exactly when to be here.
They say it takes a village, and thousands from the community show up every week, not just to get vaccinated, but to help their city and neighbors.
Hi, how are you? Did you get your form filled out? Got it. Perfect. Just follow those blue arrows. It'll get you to the end of the line. Thank you. Y'all have a good day.
So we've had lots of people come through that they get vaccinated, and then they turn around and they say, how can we help? How can I volunteer? I can't count how many people we've had do that.
Our faculty, our staff, and our students are very involved in the participation here at the clinic. When I checked this morning, we had 170 individuals from the Health Sciences Center across all disciplines that are here providing assistance.
Oh my gosh, we're just so grateful to be a part of the community's effort and thank everyone in all the departments and all the organizations who've come out to help.
If you look out there right now, I can't count how many different departments for the city, different organizations around the community, and just individuals in general that are all working together. People that don't know each other, they're coming together for a good cause, and they're doing a lot of good here and working as a team. So getting to see that, like you said, the community coming together to help another citizen, it's been amazing. You're going to write the lot number here and the expiration here.
While already impacting the COVID-19 virus, the vaccine is also positively affecting those involved with the clinics.
It's been great to work with everyone, and all the public has been fantastic. They're happy when they get here and ready to move forward.
COVID-19 has taught us the importance of population and public health. And oftentimes, as a health sciences center, an academic health sciences center, we're called upon to help communities respond to these types of epidemics and pandemics. So it's been very positive for our students, number one, to have these patient experiences, and then also see how a community can respond and have a positive impact.
Practical application.
Absolutely. Better than anything in a textbook.
After months of staying home and being distanced, the best medicine is sometimes just coming together.
I know we've all experienced personal and professional challenges through this, but as a community, we have really come together in a way that we never have before.
There's so many good people that are coming through that are just genuinely nice and thankful for what's going on and what's being provided. It's been a blessing to be a part of that.
Okay, thank you for that. And now we'll get started as usual with Catherine Wells.
Good morning, everyone, and thank you, Lacey and your team, for putting together that video. It really does capture what is happening at that Civic Center clinic. I usually spend a couple of hours there every day that we're running it, and it's been great to talk to individuals in the community who are getting vaccinated. Shout out to all the first responders and nurses that are volunteering their time. I'm so happy to be such a big part of that clinic. Today, we're going to look a little bit again at our case numbers. Our case numbers continue to be low. And for the second week in a row, we are seeing our new case counts continuing to hover around that 100 mark. And we're also seeing the number of people being hospitalized due to COVID is also decreasing. And we are now below that 15% threshold that the state is looking at. We also continue to see increases in the number of people vaccinated. We now have more people that have been vaccinated than we do COVID cases, and the number of new people we're vaccinating each day is significantly higher than the new cases we're reporting. This is all good news, but remember, we can't let our guard down. We have to continue social distancing, wearing our mask, and practicing good hygiene. We have to let our vaccination rate increase and continue to see the number of cases decrease before we can reduce or stop any of those core public health measures. This week at the Civic Center, we will be providing 7,000 first dose vaccinations to the community. These appointments are all booked, but we are working with our state partners to get more vaccine for next week, and hopefully we'll be able to reopen appointments on Monday. We want everyone who is eligible to seek their vaccination. But please note that the Texas eligibility for vaccine is different than that of the CDC guidelines. We're following the Texas vaccine allocation group, and we have to follow their guidelines. So please remember that you either need to be 1A, which is going to be generally our healthcare workers, first responders who work directly with the public or respond to health emergencies. And then that second group, 1B, are individuals with underlying health conditions that contribute or could contribute to them having very poor COVID outcomes. And we want to stick to that eligibility guideline. We continue to advocate at every level to secure additional vaccine for Lubbock and our surrounding communities. And that is our goal, is to get as much vaccine here as quickly as possible and get it out to either the Civic Center Clinic or community partners to make sure that those vaccinations go into the arms of our residents. And another reminder for those that have received their first dose, please make sure you make that appointment for the second dose. Everyone needs to get that second dose in order to reach that high level of vaccine efficacy. And we want to make sure that you do that. If you want to make an appointment for a second dose, please go to Select a Seat or call the health department at 775-2933. And it's good to reach out to everybody this week. And I'll now turn it over to Dr. Cook.
Thank you again, Catherine. First of all, I want to say thanks to University Medical Center and to Covenant and Catherine and her team at the City Health Department for all the vaccinations that you have done. I truly believe that these efforts have lowered our numbers in the city. Second of all, and say thanks to Covenant and University Medical Center for their antibody infusions. They are phasing that side out, but it's continuing over at the Grace campus, the former Grace campus at 50th and University. I'll talk about that a little bit more in just a moment. And finally, I want to say thanks to the good citizens of our community who are doing their part by wearing their masks and social distancing and washing their hands to make all of our COVID numbers decrease. The whole purpose of all of this is so that our hospitals wouldn't be overwhelmed. One, to prevent death and disease, and then to keep our hospitals capable and running at their most efficient possibilities. So thank you all for all the work that you've done. And because of your efforts, our numbers are now below 15%. However, just like Catherine said, we can't slow down. We can't step backwards. Continue to wear your mask and socially distance. Even if you've had the vaccine, you must continue until we get to that herd immunity at 70 to 80%. So keep pushing forward. And to reiterate what Catherine said, right now, we're still in phase 1A and 1B for those people to get vaccinated. And as Catherine said, come get your second dose. You can postpone that dose up to 6 weeks. It's okay. It doesn't have to be right at 4 weeks if you receive the Moderna vaccine, or 3 weeks if you receive the Pfizer vaccine. It's safe, very rare complications, like 1 in a million for the Moderna. That's very, very low. You are going to have some muscle aches and maybe some fevers and some soreness in the worst case scenario. So please come get your second dose. Now back to the antibody infusions. If you are eligible, in other words, you have to be positive, you have a positive test within the first 5 or 6 days. You must be high risk to have significant poor outcomes. So obesity, uncontrolled diabetes, hypertension, an immune disorder, chronic kidney disease, lung disease. If you fit into that category, please talk to your primary care provider about getting the infusion. And starting next week, all of those will be done over at the former Grace Hospital at 50th and University. If you do get the infusion after you've had the positive test, you need to wait about 90 days to make sure that your immune system doesn't make your vaccination ineffective. Just to reiterate that. Lastly, I want to talk a little bit about the Super Bowl. You've already heard some stuff on the national news and local news. What should we do? Let me reiterate those. First of all, we're going to be rooting for our hometown, most of us, our hometown quarterback, Patrick Mahomes, right? Just a little piece of trivia. Who was the other Hall of Famer? We expect Mahomes to probably be a Hall of Famer. Who was the other Texas Tech, Kansas City Chief that was a Hall of Famer? See if you know that. Go look it up. So again, just like Christmas and Thanksgiving and New Year's, keep your parties small. Keep it within your family who live under your roof. And so now it's predicted to be nice weather in the 60s. So you could open the windows and keep the doors open, move out to the garage, move the big screen out to the garage, get some fresh air. But all the while, please stay socially distanced. When you're not eating, make sure you wear a mask and stay away from each other. The other thing there is everybody's got that favorite uncle that likes to lick his fingers and go double dip in the buffalo wing bowl. We don't need any of that. Make sure you have individual servings and use tongs and stuff like that. So that favorite uncle is not licking his fingers and double dipping. All the more reason, again, to have hand sanitizer and washing your hands in between. Have a wonderful weekend. Congratulations to the citizens that our numbers are decreasing. It's all of everybody's community effort to try to make it better, and stay safe, friends. That's all I have. Let me hand this off to our mayor, Dan Pope.
Thank you, Dr. Cook. I'm probably guilty of being the guy that double dips, so I'm going to watch that very closely this weekend. Let me share my screen with you. Let's look at data to start with, if please. You're used to seeing this slide. It's nice to see it below the orange line. This is our hospitalization rate for the entire trauma service area. As you know, that we've been below 7 days. We seem to have sort of settled around 10%. This is our case count by age group. So distribution is similar. Just the total numbers are coming down. Catherine said we are about 100, and we're actually averaging, exactly 100 new cases for the last week. Here's our hospital bed a snapshot. Once again, you can see how getting the COVID patients out of the hospital, how that frees up the hospitals to take care of other patients, both in our region and frankly, folks that other parts of the state and our surrounding states that need help. And then finally, our vaccination information. Remember that there's a little bit of lag when you look at the state numbers. The state numbers as of this morning say that in Lubbock, 38,545 people have gotten their first dose. We know that at the city clinic, 22,109 folks have had their first dose, and another 2,922 have had their second dose. And you can see that represented on this slide. Okay, so I have 4 or 5 real quick things. First of all, we continue to, as a community, battle and struggle with this pandemic. And my prayers and my thoughts are with all of you who've lost loved ones and whose families are struggling. That's not going to end. And I know the community feels the very same way. Nearly in the same breath, I want to just, in a prideful way, say thank you to our volunteers. You saw the video. It's hard for me to watch it and not just really think about how we're loving our neighbor and how we're doing the right thing. And I'm so thankful for the volunteers, for our Lubbock Fire and Rescue, for our health department, for our medical, our doctors and nurses who are volunteering their own time to help out. It's remarkable. Now, if you're having a hard time getting your appointment scheduled, please be patient, okay? The supply is not running out. In fact, it's increasing. Be patient. We expect that we'll be able to run this clinic with ample supply for the foreseeable future. So what does the 15%, going below 15% mean? Just in summary, it means that our hospitals can begin to have elective surgeries. Now that's important because those surgeries are important to the hospitals and maybe more important to the patients. And they've got not days or weeks, but more like months of those stacked up, ready to go. It also means that our restaurants can move to 75%. That puts more people back to work. That puts food on the table for Lubbock families. Bars that did not reclassify as restaurants can now open up to 50%. And finally, there's a sort of a catch-all category: museums, zoos, libraries that can go from up to 50% now from at an occupancy level. I want to comment about the support from the state. We've learned that this pandemic is certainly responding to it's a team sport, and we work closely with the state on a daily basis. The governor's office, the Department of Emergency Management, we got 8,000 doses of the vaccine this week. We're thankful for that. That's up from 5,000. I believe, have received that because we've successfully shown that when we get a dose of vaccine, we're going to get it in somebody's arm that week. That's back to the people who are doing such a great job at the clinic. Ron talked about the alternate care site at 50th and University, where the state is both doing the antibody therapeutic infusions and operating a COVID hospital wing. We're thankful for that. You'll see the blue med tents, the blue medical tents that have been at UMC and at Covenant going away. The UMC tent is gone. Covenants will be gone before the end of the month. That's a good sign. That means that we've got our feet back, our legs back underneath us, so to speak. Finally, the staffing help that we've gotten from the state is remarkable. They're staffing us with nurses, with physicians, with respiratory therapists. That has allowed our hospitals to take care of this COVID patient load, and we're very thankful for that. While we're talking about partners, We couldn't do what we're doing without great community partners. From day one, our hospitals, our grocery stores, our education system, our K-12 and higher ed, Texas Tech and Lubbock Christian. You know, both K-12 and the school districts, our private schools and Tech and Lubbock Christian have made decisions to safely open and to bring students back to the class. It works. We can do it safely. We've done it safely. You don't have to look very far to see school districts in our country where kids have not gone to school since the first week of March last year. There's something wrong with that. And I really applaud our leaders and our teachers and our parents for finding a way to make this work. While we talk about partners, I think it's important to call out United Supermarkets. So we got 8,000 doses this week, and we're going to take care of 7,000 of them at our vaccination clinic. United is taking 1,000 of those doses for us, and they are running clinics at their pharmacies. Yesterday, they were at 50th and Q. Today, they're at Amigos on North University. Tomorrow, they're at the United on Parkway. They are working through a list of citizens who've already called those grocery stores and signed up for those vaccinations. We're trying very diligently to get those vaccinations closest to our neighborhoods where some of our most, where our citizens may have mobility issues in getting to the downtown clinic. We want to make sure that access is available for everyone. I'm just very thankful. I'm thankful for our citizens taking this seriously. I'm thankful for the team I'm a part of at the health department and the city of Lubbock, Lubbock Fire and Rescue. I'm thankful for all of you and your willingness to pull together to fight this pandemic. Every day gets better. The light at the end of the tunnel gets a bit brighter. Please stay safe. Let's be hopeful. Back to you, Lacey.
Thank you, Mayor. Okay, now we will go to media questions, and here is today's media question order. Sarah Self-Walbrook, Texas Tech Public Media, Bao Pham with the Daily Toreador, Olga Aguero, El Editor, Matt Dotre, the Lubbock Avalanche Journal, Matthew Stell, KMAC, Karen McKay, KCBD, Terry Furman, KLBK, and Christy Martinez Garcia with Latino Lubbock. So let's get started with Sarah Self-Walbrook.
Good morning. First question, college students have been back in town for a few weeks now. What have we seen in that age group in particular? And have there been any issues with off-campus gatherings like we saw last semester?
Well, let me start with the gatherings. I think, Sarah, I love that question. There's no off-campus gatherings. We just know there's none. I'm just kidding. We've had a few reports. We don't seem to have the issues that we had in the fall. I'll let Catherine talk a little bit about the case volume, something we watch closely.
We're still seeing a very, a reasonable number of cases. We have not seen any significant increases associated with college students through our contact tracing efforts at this time.
All right, second question. We are all happy to see those lower COVID numbers across the board, but I don't want it to get lost that we've still lost over 675 Lubbockites in the past year. I think the answer to this has probably changed a lot throughout the past few months, but why is the death rate so high in our county?
Dr. Cook, you want to try that one?
Sarah, it's difficult to say. Certainly, we know there are those high-risk patient populations, and we are also a tertiary care center. We are the medical mecca for anything. This half of Texas, if you draw a diagonal line all the way down to Big Bend and up toward Denton, Wichita Falls area, and then halfway to Albuquerque. So we are the tertiary care center. This is where people come when they need help. And so, and need the experts. And that's what we provide in our medical community. We're fortunate to be able to provide that care. So all that to say is it's a devastating disease for those people who are highly susceptible to the disease and have significant comorbidities that make people perhaps not do well. Other than that, I don't have a great answer, Sarah, other than just we're the medical tertiary care center for our region.
Thank y'all.
Thanks, Sarah.
Sarah. Now we have Val Pham with the Daily Toreador.
Good morning, everyone.
Morning.
All right. So my first question is, other than the doses appointed at the Civic Center, so I have seen the news about how CVS pharmacies and United supermarkets will start to administer COVID vaccines to people. So is there any degree of supervision by the city officials over this distribution, or are they distributing the vaccine on their own will?
Anthony, you want to take that?
Yes, we will receive listings of who or which specific pharmacies receive vaccinations. Every provider, whether it be the health department working at the Civic Center or hospitals, doctors' offices, all have to follow the same rules, regulations regarding who gets the vaccine, prioritization, the fact that you can't charge patients. So getting a vaccine at CVS or a pharmacy is the same as going to the Civic Center. Everybody gets treated the same requirements.
All right. My next question is, so with the current progress on the first phase of the vaccination process, how long do you think it will take us to enter phase 2?
That remains to be determined by the CDC and the state of Texas Department of State Health Services. I suspect maybe, and depends on vaccine availability. So there's a new vaccine that's about to hit the market too, the AstraZeneca one. So early spring, middle spring, maybe. So soon, maybe another 6 weeks.
Right. My final question is for the mayor. So there's been this opinion going that there should be an exemption from the mask mandates for performers in theaters and on stages for better coherence, as well as athletes. So given our situation with the numbers of cases going down constantly in the past few weeks, what is your take on this opinion? So is it safe enough to allow such things in public?
Yeah, I think it's certainly, we watch, I went to a high school basketball game last night. I watched young men and women play and without wearing masks. I think it's safe for them to do that. I'm not a thespian, nor can I really comment on what it does to the quality of the performance. I think the way the governor's order is written, there's enough interpretation for each individual organization to decide how they would like to go about it. I do know that I think the UIL that governs the public schools and the competitions has come out on this, but I don't have a comment on that. That's not in my lane of traffic, and I'll keep working on what we got plenty to deal with in our world.
Okay, thank you, Val. Now we move to Olga Aguero with El Editor.
Buenos dias. Good. I guess
This.
right up. It's
Trade news.
But okay, I'm glad I'm here. I thought I was going to be running late. Took my parents to the Civic Center to get their second dose. So I had given my questions to Lacey to ask, but I made it back in time, which I'm glad. It's good to see all of y'all. My first question is, when receiving the second dose of COVID vaccine, would you say that the side effects are different on a person that has had the COVID virus compared to one that didn't get the COVID?
Olga, I can help you with that. Sure. So the question is, are you going to have more side effects if you've had COVID and then get the vaccine? Is that correct?
Yes, compared to a person that didn't.
Sure. Probably so. Your body, your immune system has seen this virus, and so it mounted a response to develop and produce antibodies to help fight it off the second time. And so then when you give bits and pieces of the virus or messenger RNA like this, and so yes, the short of the long story is yes, you will most likely have a significant response. There are some studies out there that show an exuberant response to make an antibody to the virus if you've had the actual COVID virus before you get the vaccine. So you're going to have more chills, maybe some more fevers, and just feel pretty wiped out the next day. They are short-lived, and it's not the actual COVID disease. It's just your immune response because it's already seen the vaccine or parts of the virus before.
Good. That was good to know. Thank you, doctor. Okay, let me see. Can we, or I guess this is a question for the mayor. Can Lubbock say more or less right now, Mayor, that all health caregivers, including nursing home caregivers, teachers, essential workers like firefighters, can we say that they have all gotten tested?
Gotten tested or gotten the vaccine?
Vaccine, sorry. Thank you.
Yeah, so they've all been offered the opportunity to have the vaccine. Okay, so let me clarify. Frontline healthcare workers, nursing home workers, home health, hospice, first responders. Catherine, did I leave anybody out?
You're good.
They've all been offered the opportunity, and the vast majority of them not only have gotten the first, but they've gotten the second dose of the vaccine. If they chose not to get it and they've changed their mind and they want to get it now, we'll get them vaccinated. Okay, so they have every opportunity to continue to do that, but I would say that they've all had that opportunity.
Does that include teachers as well?
Teachers are not in the.
They should be. I hear you.
That's neither here nor there. If they're in the 1B category, if they're in the 1B category, we've worked very hard to get them vaccinated. Working with the school districts, with Texas Tech, with Lubbock Christian. But remember, Olga, we've seen virtually no spread in the classroom. As long as folks are wearing masks, it's very safe. Most of our spread in K-12 in particular has been in extracurriculars. I think you can make the same case in higher ed also. It's not happened in the classroom.
I hear you. I understand, but the concern is out there, Mayor.
Well, it's a concern, but the reality is, I mean, California is still not going to school, and it's because the teachers' unions won't relent. The data doesn't support it, and that's why I applaud our people for making the right decisions. Parents can still, excuse me, Olga, please let me finish. Let me finish. Parents can still keep their kids at home. They have a hybrid option if they choose to do that, but we can do it safely.
I hear you. Thank you.
Thank you.
Thank you, Olga. Now we have Matt Dotre with the Lubbock Avalanche Journal.
Hey, Mayor. Good afternoon, everyone. Mayor, do you think hospitals and those home health and I guess all those businesses, do you think they should be requiring, would you like to see them requiring that their workers get vaccinated?
You know, that's not my decision, Matt. I'd like everybody to be vaccinated if I had, if I could wave Dan's magic wand. But I think employers are explaining the benefits and trying real hard to encourage their employees to be vaccinated, particularly those that are on the front lines. It's a safe and effective vaccine, and that continues to be our message.
Dr. Cook, kind of a follow-up to that. So do you think Lubbock will reach the herd immunity that we're all kind of aiming for without businesses and without employers requiring that their workers get vaccinated? Like, do you think 80% of the people in Lubbock will voluntarily get vaccinated?
I hope so. And I think as we see peers and colleagues getting the vaccine and doing well and not getting further disease. And as we continue to get our numbers down, I hope so. Everything that we have thus far says this is, I agree with the mayor, it's a very, very safe vaccine. And, you know, one person in a million has a severe reaction. One person in a million for the Moderna vaccine, and it's like 2 in a million for the Pfizer vaccine. That's pretty low, and I will gladly tolerate a little low-grade fever or chills, muscle aches, those sorts of things, so that I don't end up in the hospital. And nobody truly knows if they will be in the hospital or not if they catch this virus. So it's going to take time, and just continue to encourage people to get it. So we'll see.
Absolutely. Very good. Thank you, everyone.
Thanks, Matt.
Now we move on to Matthew Stell with KMAC.
Thanks so much, Lacey. Good afternoon, everybody. Quick question and a quick follow-up after. This is to anybody. Of course, we're seeing that our numbers are going down. Our daily case numbers are going down, which is great to see. But my question is about testing. Are the same amount of people still getting tested as they were maybe 3 or 4 months ago? And as our positivity rate just gone down when it comes to testing, what do the numbers look like?
Catherine, you want to start on that?
Yeah, I think we're seeing less disease, so we're also seeing less testing. But places that are doing a lot of testing, for instance, are emergency rooms. They're also seeing a decrease in the number of positives. So that makes me feel that it's very much a true decrease and not just fewer people accessing testing.
And our positivity rate is going down, Matthew. It's still not maybe where we'd like it to be, but it's much better than where it was 60, 90, 120 days ago.
Got it. Okay. Mayor, one last question for you. Are folks still requesting permits to have gatherings for more than 10 people? And if so, have any been approved recently?
We've seen very few requests recently. Remember that our permits are on outside events. So indoor events are covered under the governor's order in another way. My guess is we'll start to see those as the weather gets better. I know we've got some on the calendar, some youth sports events and some of those type things, but that part of the governor's orders remains. That does not change with us getting below 15%, and we'll continue to work to safely, work with the organizers of those kind of events.
Got it. Thank you all.
Thanks, man.
Matt. Now we have Karen McKay with KCBD. Karen, can you unmute, please? Okay, Karen. Okay, we'll move on. We'll come back to Karen after our next person. Now we're going to move on to Terry Furman with KLBK.
Good afternoon, everybody. Hope everyone is well. Looking forward to the Super Bowl myself because it's on CBS this year, so make sure you're watching that. Okay, here we go. We've seen a lot of lines outside of bars in the Depot District. No masks, no social distancing. And I know it's the TABC's kind of a responsibility to monitor that, but are we monitoring that? And how are we making sure that those lines, no masks, everything, that everyone is following the rules?
I think we talked about this last week. I mean, we work closely with TABC. Let's start with that. Lubbock Police, Sheriff's Office, we work closely with TABC. We do not have oversight for those bars. We do work with those bar and restaurant owners to remind them of the governor's order, to provide them any support we can. But we don't have people outside watching those lines, telling folks what to do.
Okay, very good. Then secondly, I want to clarify with both Dr. Cook and about the number of people that were in hospital that died in Lubbock. Our number is 676, and that is just for the city of Lubbock, correct?
Yes.
It's the county.
Lubbock County.
Okay, so our number 676 deaths is for Lubbock County on the city of Lubbock website.
That's correct.
Okay, very good. That's all I had. Thank you.
Thank you, Terry. Now move back to Karen McKay.
Hi, can you hear me now?
Yes, ma'am.
Yes.
Sorry, I'm late to the party. First, I want to say, Dr. Cook, I appreciate your comments so much about people who have had COVID and have the first vaccine, they have a reaction, because I did, and I wondered about that. So it's good to know that that's normal, that you kind of feel like you have COVID again. So thank you so much for explaining that. My question now is, NBC is saying there are variants in 33 states, but can you be more specific about our area? Is it here? And really, does it even matter that much? If it just means, I don't know, does it matter if a variant is here? And how would you know if you're tested and they say you have COVID? Is it regular COVID or the new COVID?
It's a great question, Karen. I have no evidence that it's here. Now it's in Houston, for sure, in a few other places. But just with our given travel and transient society, I would fully expect it to be here. We don't have any evidence of it, though. One way to pick it up, if it's the more infectious one, is that all of a sudden our numbers will start to climb again, perhaps, because there's one variant or a few variants that are more infectious. You can do genotype typing on them, so it would require to take a sample and send it to Austin and request genotype typing. So if we see our numbers bounce back up, that's something that we might do. But the prevention is still the same. Get the vaccine and social distancing, wear your masks. I can't reiterate that enough. And so even if you receive the vaccine, still make sure you wear your mask and socially distance. Wash your hands.
What about excuse me, I'm sorry.
Okay.
What about Miss C? Is that becoming more of an issue, or are we seeing less of that as well in kids?
I don't have a number on that. We've had a number of cases here in our Lubbock Children's Hospitals with Miss C. That's multi-inflammatory system disorder in children is what that stands for. It's a significant disease. It looks like the adult COVID, but early on we thought children were somewhat spared from this, but this is after they may have a mild case of COVID, then go home and then have some type of relapse several days or a few weeks afterwards. So it's a significant disease, and we've had a number of cases here as well.
All right. Again, thank you for your comments earlier, Dr. Cook.
You bet. Thanks, Karen.
Thank you, Karen. Now we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. Mayor, I just want to make your day today. That's my goal.
Good. Go get after it. Make my day. And that what did Clint Eastwood say? Is that what he said?
Listen, I know we're talking about second vaccines now, and but nationally we're seeing an upward trend of people not following through and getting that second vaccine. Are we seeing any type of issues like that in the Lubbock area?
Yeah, we talked about that. Catherine, I think Catherine's got some data on this.
Yeah. I haven't seen, we have had very good uptake here locally with the second vaccine. So much so that I've even opened up additional second vaccine appointments. So I think we're very close to almost 100% of those initial people getting that second dose. In about a week or two, I'll have some data that will actually be able to show us who of those people that received vaccine the first 2 or 3 weeks who hasn't gotten that second dose. We will be doing targeted outreach to those individuals.
this is still a part of this question, but I think it's important because of the phone scams. And I think even Terry Furman asked last week, are you guys actually making the phone calls to individuals for their vaccines or not? Because I think there was some confusion about that.
Not at this time. We're returning phone calls for people that have reached out to the health department. We are not making cold calls to people that have not received their vaccine. At some point, in the next week or two, we will be reaching out to those people, but the individual will identify themselves as a City of Lubbock Health Department employee, and the person's welcome to call the front desk if they want to verify.
And we'll be communicating. We'll let people know as we initiate that effort. So to make certain that they realize we are going to start making outbound calls.
So, Christy, I do want to clarify just a little. There have been a few providers in the community that are calling certain high-risk patients, but it should be from that provider's office, and that number and or voice would be recognized by the individual that they're calling. There's been a few of those, not many.
Great point.
So this is my next question, and I think this is important because you're hearing wear your mask, continue to follow the process, social distance, all of the above. But then, Mayor, you just told one of the reporters that there's nothing you can do if people aren't wearing masks. And you see how it just sends the wrong message. It's confusing to the public. You basically have told us these are the mandates or these are the rules, but then, you know, people can go to extracurricular activities and, you know, we're not seeing a lot of numbers increase, but then you're seeing children that are getting from the extracurricular. So there's a lot of different messages and it makes it very difficult. Bottom line, how are we going to continue to get people to wear their mask? And I know you can't do anything, but then what is the point of telling them all that?
Well, first of all, it's a really good question, and it's not something that we're just learning. You know, this is the maybe the most pervasive issue we've dealt with, Christy. It's you know, if you're going to come to my house, you know, we're going to ask you to wear your mask. There's certain businesses in town that's their rule. Texas Tech basketball has done a very good job with requiring people to wear their mask. I think all we can do is make the case to citizens how by wearing their mask, they first of all protect themselves, and second, they protect people they love, and third, they protect their neighbors. Mm-hmm. Even if they're asymptomatically carrying the disease, that underscores the reason why you should wear your mask. And you know, that's been my plea and my admonition, including, you know, famously using some rather coarse language early on. But we've got to wear a mask, and you know, that's it's no different today than it was in May or in July or in November. Mm-hmm. Please wear your mask.
I have just a phone number to give you because one of the concerns that I saw was people unable to get to the vaccine sites, especially from low income. May I give that number to you or share it with the audience, because I feel like it's important for those that might not have transportation. So.
Yeah, why don't you just go ahead and, if you have a transportation source you want to share right now, please do so.
The number to get to vaccination sites, you can call 806-894-3800 or 1-800-462-8747. That is a combination of Spartan as well as work with I think it's the Department of Health. And you can also go to their website at dshs.state.tx.us. They do require that a reservation be made 24 hours in advance. So I think that's important, and I'll share that information that was sent to us today.
That'd be great. And if we don't have that on our website, I bet we can have it up by the end of the day. Okay.
Absolutely.
Thank you for that. Okay. Thanks, Christy.
Thank you, Christy. Okay, and that concludes our news conference for today. Thank you for joining us, and thank you to our panelists and our interpreter.